Okay, let's unpack this. When we think about healthcare, our minds often jump straight to, doctors, maybe nurses, or that high-tech equipment.
Yeah, the visible stuff in a hospital setting.
Exactly. But beneath that surface, there's this vast, often unseen world of essential heroes, the true backbone of daily care.
Mm-hmm.
We're talking about certified nursing assistants or CNAs.
And what's truly fascinating here is just the sheer breadth and depth of knowledge this role demands. It's often kind of hidden in plain sight. It's
Yeah.
far beyond just following a list of tasks. It's
Mhm.
about this continuous dynamic assessment of human needs and safety.
Absolutely. So for this deep dive, we've pulled together a stack of sources. Mostly, it's a collection of CNA practice questions.
Okay.
Now, that might sound a little dry, maybe, but trust us, it's really anything but.
I imagine there's a lot packed in there.
Oh, yeah. Our mission today is to extract the most potent nuggets of knowledge. We want to reveal the critical thinking, the rapid decision-making, and honestly, the profound empathy that's just embedded in their daily work.
Mm-hmm.
And for you, our listener, this isn't just about healthcare settings. It's really about understanding these nuances of observation, immediate action, and person-centered care.
Skills that are relevant everywhere.
Totally. They're incredibly relevant in so many aspects of life. So get ready for some serious aha moments about this unsung artistry of caregiving.
Looking forward to it.
Okay, so here's where it gets really interesting. The world of caregiving, it's not always routine, right?
Not at all.
Sometimes CNAs are the very first, maybe the only person present when a genuine crisis hits.
That's a huge responsibility.
It is, and there's no time for hesitation. It's all about immediate, often life-saving, pre-programmed action.
Absolutely. This is where that resident first principle really shines. It demands instant triage, prioritizing human safety above absolutely everything else.
Right.
It's about knowing exactly what to do when every single second counts.
It's just astounding how much CNAs have to internalize, isn't it?
Yeah.
These aren't just tasks on a list.
No, they're immediate, potentially life-altering decisions.
So what's maybe the most surprising element of this kind of rapid response training?
I think what really stands out is the hierarchy of safety that's just drilled into them. Take a fire, for example.
Okay.
If a CNA walks into a resident's room and say, a trash can is actually on fire, the very first action, the absolute first thing they're taught
What is it?
is to remove the resident from the room, get the person out.
Ah, okay. Not fight the fire first.
No, the immediate priority is life, not property, not even putting out the fire yet.
Yeah.
You don't grab an extinguisher until that person is safe.
That makes complete sense. Life over everything. And this rapid assessment, it isn't just for fires, right? It applies to something like a fall, too.
Exactly. Imagine a resident, maybe someone with a known history of falls, is lying on the floor, they're crying, saying, I fell again.
Yeah, that's tough. What's the critical first action there? Your instinct might be to pull them up.
Right, that's the instinct, but it's often the wrong one initially. The sources are clear. The first action is actually to call for help, while keeping the resident calm, and this is crucial, asking them to stay still. Don't move.
Ah, okay. Because moving them could cause more harm.
Precisely. Moving someone immediately after a fall risks making an injury worse, maybe a fracture or something. It's a really powerful lesson in calculated caution.
Wow. Okay. And what about something as terrifying as choking? Say a resident grabs their throat, they can't speak while eating.
Yeah, that's a classic emergency textbook. The first response, begin abdominal thrusts immediately.
Okay, the Heimlich maneuver.
Right. But the situation changes slightly if they can speak, even a little.
Oh, how so?
Well, if they can make some sound after calling for help, you first ask, can you talk? Or can you speak?
Why ask that?
Because it helps assess the severity of the obstruction. Are they getting any air at all? It guides the next steps. It's a very nuanced, immediate assessment.
So what this really shows us is that a CNA isn't just like following rules blindly.
No, not at all.
They're operating on this deep understanding of first principles. Often that means immediate human safety above all else.
Mm-hmm.
And knowing the exact sequence of actions that can literally buy someone precious minutes or, even save a life, it's just a profound responsibility.
It really is. And that leads us nicely into another important question. How much attention to detail is truly needed in what might seem like, routine care?
Right, the day-to-day stuff.
The answer is an immense amount. CNAs are the constant observers. They're like the frontline diagnosticians, often spotting critical details before anyone else does.
So it's way more than just a checklist. It's about this constant, informed vigilance,
Oh.
almost like connecting dots that aren't obviously related.
Exactly, connecting seemingly disparate symptoms into a coherent picture of someone's health.
So what's one of the most common yet really critical areas where this vigilance pays off?
Vital signs, undoubtedly. Things like temperature, pulse, breathing.
Okay.
When taking routine vital signs, if a resident's temperature is suddenly high, say 101.4 Fahrenheit,
It's quite high.
or if someone who's usually alert and oriented suddenly seems scared and confused, or maybe they're having trouble waking up, not really talking.
Those sound like big changes.
They are. And the most appropriate response, the immediate thing to do, report this change to the charge nurse right away, instantly.
Okay.
These subtle shifts, or sometimes not so subtle shifts, can signal really serious underlying issues that need urgent medical attention. The CNA is essentially the early warning system.
That's a crucial observation. It really points to the constant vigilance required. It's a testament to the power of just noticing small deviations from the norm, isn't it?
Absolutely.
A skill that's incredibly valuable whether you're a CNA or a parent or even like a project manager spotting risks.
It's true.
So beyond vital signs, what other subtle physical observations can signal a more serious problem brewing?
Well, recognizing signs of serious distress is another critical skill. For instance, a resident reporting pain in their arms and jaw, maybe feeling nauseated, looking pale, sweating.
That sounds familiar.
Right. A CNA is trained to recognize those as potential heart attack symptoms,
Wow.
and they need to report that immediately. It's about connecting those seemingly separate symptoms.
Okay. Any others that come up often?
Yeah, another common one is with low blood sugar. Observing shakiness or trembling, maybe sudden weakness, those are immediate red flags.
Got it. And what about something like skin integrity? That seems really vital for comfort and preventing other complications.
Oh, absolutely crucial. Noticing even just a reddened area on a resident's hip, for example, requires immediate reporting.
Why is that so important?
Because it could be the very first sign of a pressure injury, what most people call a bed sore. And the nurse would likely then request repositioning to relieve that pressure. And for dark-skinned residents, this is really important.
Yeah.
It's particularly important to know that the early signs of skin breakdown might appear purple, not pale or red.
That's a critical distinction to be aware of.
It really is. And to prevent things like skin tears or shearing, which is damage from friction and pressure. CNAs are taught specifically to avoid pulling or sliding the resident when moving them. Gentle handling is key. Sometimes even dressing residents in long sleeves can offer a bit of extra protection.
So it's really about proactive prevention, not just reacting.
Exactly. It's constant vigilance for prevention.
So whether it's the color of toes with elastic stockings or fingers with a hand splint, circulation is paramount.
Absolutely. Cold blue fingers on a hand with a splint. Report immediately. Pale toes in stockings. Check and report.
And speaking of the body's subtle signals, what about observations related to elimination or fluid balance?
Good question. New swelling in a resident's ankles, for instance, needs to be reported. It could indicate fluid retention, maybe a heart or kidney issue.
Okay.
And for a resident with an indwelling urinary catheter, that's the tube placed in the bladder to drain urine continuously.
Right.
If there's suddenly low urine output, maybe only 50 cc's in 6 hours, which isn't much. Or even if the resident just says, I feel like I need to urinate, even with the catheter in.
Yeah. What's the first step?
The first thing a CNA should do is check the tubing. Is it kinked? Is it bent? Is something blocking the flow?
The simple mechanical check first.
Exactly. It's a classic example of always rule out the simplest mechanical issue first before assuming a bigger medical problem.
That's such a practical, immediate troubleshooting step.
Okay.
Okay, and what if a resident is having trouble with eating or swallowing?
That's another key observation area. If a resident keeps coughing a lot after each drink of fluid, for instance,
Yeah.
the appropriate response is to stop feeding immediately and ask a nurse to come check the resident.
Why stop?
Because that coughing could indicate an aspiration risk, meaning food or liquid might be going down the wrong pipe into the lungs instead of the stomach.
Oh, that's serious.
Very serious. So this really highlights the CNA's role in protecting the airway and preventing potentially severe respiratory issues like pneumonia.
Wow. The common thread through all these observations, it seems to be the CNA's role as the crucial eyes and ears of the healthcare team.
That's a great way to put it.
They're often spotting these critical details that then inform higher-level medical decisions. It truly is a profound early warning system.
Indeed. And, beyond these clinical tasks, there's such a profound human connection at the heart of caregiving.
Right. It's not just about the body.
Exactly. CNAs are also compassionate companions and really skilled communicators. This next section truly highlights the paramount importance of resident rights, of person-centered care, and that empathetic communication, especially in challenging situations like dealing with dementia.
That makes me wonder, given the really varied needs and, cognitive states of residents, how do CNAs navigate that balance between preserving dignity and autonomy while still ensuring the necessary care gets done?
It's a very delicate balance, requires real skill. First off, nursing home residents fundamentally have the right to make decisions about their own care and treatment. That's a bedrock principle.
Okay, so how did that play out practically?
Well, say a resident refuses to be ambulated to walk at 10 a.m., even though it's on their care plan. The best response isn't to force it or argue. It's to ask something like, okay, would you prefer to walk a little later?
Offering a choice.
Exactly. Offering options, respecting their preference. Similarly, if they refuse a morning shower, you don't just skip it. You might ask, okay, do you have another preference for bathing today? Maybe later, or a bed bath.
So it's about finding alternatives that still meet the care need, but respects their choice at that moment.
Precisely. It's about offering options, not just issuing ultimatums. It shows respect for their choices.
That's a great example of person-centered care in action. What about residents living with dementia? That must introduce even more complex communication challenges.
Oh, absolutely. This is where empathetic communication truly becomes an art form.
How so?
Well, imagine a resident states something like, I am not going to eat this food. It is poisoned.
Okay, that's a delusion, clearly. How do you handle that?
The best response isn't to argue with their reality, saying, no, it's not poisoned. That often just increases agitation. Instead, you might gently ask, okay, I understand you don't want this. Is there something else you might like to eat instead? You validate the feeling behind the statement, the fear or refusal, without confirming the delusion itself.
Redirecting gently.
Exactly. Similarly, if a resident believes her husband, who perhaps passed away years ago, will be home soon, or maybe her daughter is coming home from school when the daughter is grown.
Yeah, those situations must be common.
They are. And again, direct contradiction is usually counterproductive. The best approach is often validation of the feeling or the memory.
How would you do that?
You could engage them in that reality gently. Ask about her husband's favorite dinners, maybe, or say, oh, what do you like to do with your daughter when she gets home from school?
Ah, so you join them in their memory or their world for a moment.
Yes. It engages them where they are in their reality without confrontation. It helps prevent distress and, importantly, maintains that human connection.
That's such a powerful technique, meeting them where they are emotionally, rather than constantly correcting their factual reality.
Yeah.
It really speaks to the profound impact of validating a person's feelings, even if the facts aren't quite right.
It does. It prioritizes emotional well-being and connection.
And what about managing things like restlessness or confusion, especially, later in the day? I've heard of sundowning.
Yes. Sundowning is a common term. It describes when residents, particularly those with dementia, become more restless and agitated as the day goes on, usually late afternoon or evening.
Okay. So if a resident with Alzheimer's is restless, maybe they're pacing, rubbing their stomach, what should a CNA do?
The first step is observation and reporting. Report it to the nurse, but also try to figure out the cause. Check if the resident might be hungry or thirsty or maybe needs to go to the bathroom.
Looking for the underlying need.
Exactly. Behavior is often communication. Similarly, if a resident tries to get out of bed without help during the night, the immediate action should be to try and find out if there is something specific they need. Are they looking for the bathroom? Are they uncomfortable?
So it's always about problem solving through empathy, trying to understand the why behind the action.
That's the goal, yes.
And what about end-of-life care? That's another really sensitive area. How does the CNA's role shift then?
Well, for a resident receiving end-of-life care, the care plan really centers on providing comfort. Physical comfort, emotional comfort, spiritual comfort, if appropriate.
Okay.
It's also expected, and really important, that CNAs continue to talk to residents even if they are comatose. Talk to them while providing care.
Why is that important?
It acknowledges their presence, their dignity. Hearing is often considered the last sense to go. It shows respect, even when verbal response isn't possible.
That's beautiful, actually. And understanding things like advanced directives.
Absolutely critical. Understanding, for instance, a DNR order, which means do not resuscitate, is vital. It guides the care provided, respecting the resident's documented wishes about medical intervention at the end of life.
So it's about respecting wishes right to the very
To
end.
the very end.
So what's the core takeaway here from this section? It feels like it's all about preserving humanity, respecting autonomy even when it's challenging, and building trust, especially when a resident's cognitive abilities are challenged. It truly is a profound level of care that requires, well, deep compassion and really skillful communication.
I agree. And what's fascinating here is how all these individual actions, the observations, the communication, the emergency responses, how they all sort of coalesce into a structured, highly professional approach to care.
Right, it's not random.
No, it's guided by detailed care plans, by strict ethical boundaries, and this unwavering commitment to prevention.
So it's about knowing your role within the team, collaborating effectively, and adhering to these strict guidelines for everyone's safety and well-being. How do these care plans you mentioned function as the foundation for that professionalism?
Care plans are essentially the blueprint. They're crucial documents. They provide CNAs with specific information about the care required for each individual resident.
Personalized.
Very personalized. And importantly, they outline the goals of care for that person. For instance, a care plan might detail very specific transfer techniques to use for someone with mobility issues.
Okay.
Or it might specify consistency in toileting schedules, maybe every 2 hours, for someone undergoing bowel and bladder retraining. For new residents especially, the CNA always gets specific instructions from the charge nurse about their particular needs and assistance levels.
So it standardizes the approach, but also personalizes it for each resident.
Exactly. It ensures consistency and that everyone is working towards the same goals for that person.
Okay. And beyond the plan, meticulous hygiene and infection control must be absolutely non-negotiable, right? It's about protecting both the resident and the caregiver.
Oh, precisely. Meticulous hygiene is completely non-negotiable, not just for basic comfort, but to actively prevent infections and skin breakdown, which can lead to serious problems.
So what does that look like in practice?
It means incredible attention to detail, like when providing perineal care, cleaning the genital area, using a fresh, clean part of the washcloth for each single washing and rinsing stroke.
Wow, that's specific.
Yes, it prevents spreading bacteria. Or ensuring proper technique, like gently retracting the foreskin for uncircumcised male residents during cleaning and then replacing it. And of course, hand hygiene, washing hands constantly and wearing gloves are critical throughout all aspects of care.
Like when?
Whether it's for colostomy care, which involves managing a surgically created opening, usually on the abdomen for waste elimination, or something seemingly simpler like emptying a urinary drainage bag or even handling soiled linen. Gloves and hand washing are constant.
It sounds like a constant state of vigilance against unseen threats, like bacteria and viruses.
It really is. Infection control is paramount.
Okay, what about preventing more obvious discomforts or injuries like, say, burns? Hot water seems like a risk.
Definitely a risk. And prevention is absolutely paramount there, too. To prevent burns, a CNA always checks the water temperature before showering a resident, usually with a thermometer first, then often on their own wrist, and then asks the resident to check it themselves, if they're able.
A double or triple check.
Yes. It's about multiple layers of safety. The same principle applies to foot care, checking water temperature before soaking feet. It's about being absolutely sure.
Makes sense. And if a minor burn does happen?
The immediate first response is always to cool the area. Wet a towel or napkin with cool, not ice cold, but cool water and place it gently on the injured area. Then report it, of course.
Got it. Okay, and ensuring professional boundaries and appropriate reporting, that seems like another huge pillar of professionalism, especially when you're dealing with vulnerable populations.
It's absolutely foundational. A CNA needs to know their scope of practice inside and out.
What does that mean exactly, scope of practice?
It means the tasks and duties they are legally allowed and trained to perform. So if a charge nurse asks a CNA to perform a task that's not part of their scope, maybe inserting a tube or giving medication, the CNA must refuse.
Really?
Yeah.
They have to refuse their boss.
Yes. They must politely but firmly refuse and explain that the task is not within their role or scope of practice. It's about patient safety and adhering to legal and professional standards.
Okay.
Similarly, if they're assigned a procedure they've maybe never done before, let's say post-mortem care for the first time,
Yeah.
the professional thing to do is to discuss their lack of experience with the nurse before attempting it. Ask for guidance, supervision, or clarification. This isn't defiance, it's professional responsibility. It's about knowing your limits to ensure safety and proper care.
That makes a lot of sense. It's about protecting everyone involved, including themselves and the resident. And what about reporting difficult situations like suspected abuse or maintaining privacy?
Non-negotiable reporting. Any suspicion of abuse, physical, verbal, emotional, financial, must be reported immediately according to the facility's policy, usually to the charge nurse or supervisor.
Even if the resident doesn't seem upset.
Yes. Even if the resident doesn't seem visibly upset or hurt, the observation must be reported immediately. For example, witnessing another staff member yelling and cursing at a resident, that's verbal abuse. Report it right away, after ensuring the resident is safe, of course.
Okay.
Even if it's a family member, like a spouse who maybe slaps a resident during a visit, even if the resident doesn't react much, that observation must be reported to the charge nurse immediately. You report what you see or hear objectively.
Wow, okay. Zero tolerance.
Absolutely. And when it comes to privacy, the Health Insurance Portability and Accountability Act, or IPA, is the law. It's huge.
Right. IPA.
It identifies protected health information, anything that can identify a patient and relates to their health status, care, or payment, and that information must remain confidential. No gossiping about residents, no sharing info inappropriately.
Okay, so professionalism covers scope, safety, reporting, and privacy.
Among other things, yes. It really brings to light the challenge of ensuring every single interaction upholds dignity and safety, operates within clear professional guidelines, while still fostering the best possible quality of life for the resident. It's a truly holistic approach to care.
What a journey this has been through the profound, yet, like we said, often inviolable world of caregiving.
It really is multifaceted.
Yeah, from those immediate emergency responses to the subtle art of observation, the depth of human connection needed in communication, and then this bedrock of professional practice.
Yeah,
The CNA role is just incredibly complex.
indeed. This deep dive, using those practice questions as a lens, it reveals not just a list of tasks to be checked off. It reveals a comprehensive philosophy of care. It's about synthesizing all this diverse information, connecting the dots constantly, and always prioritizing the residents' well-being and dignity.
And often making critical decisions in a heartbeat.
In a heartbeat.
It's about being that frontline diagnostician, the safety officer, the empathetic listener, and the consistent advocate all rolled into one. The knowledge required is just immense.
And the responsibility is even greater.
Absolutely. So we want to invite you, our listener, to maybe consider this. How can these principles, we've talked about principles of keen observation, noticing those subtle reddened areas of concern or checking for the kinked tubings in a system.
The small things that mean a lot.
Right. How can that kind of observation, plus rapid assessment, plus that person-centered communication, how can they apply to seemingly unrelated fields? Or maybe even just in your own daily interactions?
That's a great question to ponder.
Yeah. What underlying needs or maybe unspoken cues might you be missing in your own sphere? At work, at home? And what difference could taking a deeper dive, be more observant and empathetic really make?